This is Selma Schimmel in Chicago for the group room. We're at the 2012 Multidisciplinary Symposium in Thoracic Oncology, which is brought to you by ASTRO, IASLC, ASCO, and the University of Chicago. We're joined by Dr. Nirav Kapadia, Chief Resident in the Department of Radiation Oncology at University of Michigan Medical School and Hospital Comprehensive Cancer Center in Ann Arbor. Welcome.
Thank you.
And we're going to talk about stage 1 non-small cell lung cancer patients who receive radiation therapy by itself are actually living longer than they used to.
So what we did is we looked at the SEER-17 database, which is a compendium of cancer patients across the country. And the SEER-17 database comprises about 1/4 of the U.S. cancer population. And what we did is we looked at patients going back for an 8-year stretch from 1999 to 2008. And we found that there were about 50,000 patients who were diagnosed with stage 1 non-small cell lung cancer. Then we split that time period in half, and we looked at the first half of the group, which was about 27,000 patients, versus the second half, which was about 26,000 patients. And we looked to see how patterns of care are changing with time, and if survival is changing with time.
And what did you find?
And what we found was that survival is improving for almost all patients, regardless of the therapy they receive. Surgery patients are surviving longer, radiation patients are surviving longer, and patients who actually receive neither treatment are also surviving longer.
So what distinguishes your study? Why is this such an important study for lung cancer patients?
I think there are two major take-home messages from our study. The first one is that patients who get radiation by itself are surviving longer. While we saw an improvement in all patients with stage 1 non-small cell lung cancer, probably the most dramatic improvement was seen in patients who got radiation by itself. The second thing that we learned, which is I think also very interesting, is that the number of patients who actually received radiation as a proportion decreased. So in the earlier time period, about 14% of patients were getting radiation alone. In the later time period, about 13% of patients received radiation alone. Going along with this, there was also a decrease in the number of patients who received neither radiation nor surgery, which are considered the two curative therapies for stage 1 non-small cell lung cancer. While there was a decrease in the percentage of patients, still 1 in 6 patients in the later time period are not receiving a curative or a potentially curative therapy.
Talk to us a little bit about the side effects associated with radiation, and what does a patient really need to be prepared for mentally and physically when they undergo radiation therapy?
Radiation for stage 1 non-small cell lung cancer typically uses a modality of radiation called SBRT, or stereotactic body radiotherapy. And what this permits us to do is use very large amounts of radiation given in just a few treatments, sometimes as few as 1 or 3 treatments, depending on the size of the tumor and where it is in the patient's lungs. Radiation treatments themselves are painless, they're non-invasive, and they're an outpatient procedure, which is to say you would come to our clinic in the morning, have a radiation treatment, and be home in time for lunch.
I would love to demystify the experience, because the first time a patient walks into the radiation therapy room, treatment room, the door is intimidating itself, and the machine is very large, and the patient is alone in there. How would you demystify it when you know it's really scary the first time that door closes?
Sure. So what I typically tell patients is that there is a lot of activity and a lot of hustle and bustle that are happening around you the first time and the first few times you get the radiation. But after a while, you'll begin to understand the routine of that hustle and bustle about what's going on around you. And then after a while, to be honest, it just becomes a nuisance and kind of boring to lay on the machine while it's doing its thing.
What would be perhaps the 3, 4, 5 questions that you would say you must ask your doctor these questions, and especially taking into consideration your research with stage 1 cancer?
Sure. I guess the first question I would have for my physician is, am I a stage 1 non-small cell lung cancer patient, and have all the tests been performed to confirm that? Typically the answer is yes. We believe that these staging scans, the PET scans and the CAT scans and so on and so forth, are of high enough quality and performed routinely enough that we can be confident a stage 1 lung cancer patient is a stage 1 lung cancer patient. The second question I would have the patient ask their physician is, am I fit for surgery? And if yes, then they should go for a surgery. The question is no, then it becomes a slightly more complicated issue, whereas they should be referred to a radiation oncologist for a further discussion.
Where do you see the future going as we evolve with radiation therapy?
What I would say the future of the field is evolving towards is a more integrated and more multidisciplinary field where we actually begin to use predictors of either patient markers, so patient tissue samples or patient blood samples, or tumor markers to predict which patients are going to respond very well to radiation, and as a corollary, which patients may have a higher response as far as toxicity to the radiation goes. So this biomarker revolution, which I would imagine will really go underway in the next 10 or 20 years in our field, will, I think, be the next forefront in radiation therapy.
Thank you for sharing hopeful research that, and the bullet points, so patients know that if a modality hasn't been presented to them, that they have to self-advocate. And this is an educational process, and I thank you for sharing in that.
Right.
Dr. Nirav Kapadia, Chief Resident in the Department of Radiation Oncology at the University of Michigan Medical School and Hospital Comprehensive Cancer Center in Ann Arbor. I wish you luck in your career.
Thank you. Thanks for your time, and thanks for doing this for the patients.